Welcome back, everybody, to another episode of Explain This. I'm with the star of the show, Robin Riddle. Robin, how you doing today?
Doing great. How about you?
I am wonderful, and I'm excited about this topic because it's something that I know inside the office and on our YouTube channel, we talk about it a lot, but we don't go in detail. So, guys, we're talking about progesterone today. You've heard it. We've talked about it a little bit before. Robin, you're going to explain it for us today.
I am. Let's do a little deep dive into progesterone. We always talk about the hormones all together. So I decided to do a series talking about each one individually, kind of more of a focus. So we've already released the one about testosterone. Today I'm going more in depth on progesterone, what it is, what it does for us, why we need it. So in young, healthy, cycling females, progesterone is the hormone that's responsible for helping to build up the uterine lining to prepare it for a pregnancy.
Okay.
Whenever pregnancy doesn't occur, progesterone drops. That triggers a period. We go through that whole cycle again the next month. When we are not getting those normal cycles of progesterone, either for some sort of deficiency issue or premenopausal type things, we start to have some symptoms come along with it. So progesterone is developed. It's produced in the adrenals and in the ovaries. So significant stress can cause some stress on the adrenals, which can cause some issues with progesterone production. And then ovarian failure, which is menopause, can also affect this. So different symptoms of low progesterone. These are things that are going to bring people into me saying, hey, I've got something going on. Tell me what's wrong. Irregular cycles. So in younger females who are still supposed to be cycling, those cycles can become very irregular, either really long, really short, bleeding in between. Very common with PCOS, which we've talked about before, polycystic ovarian syndrome. We tend to not have enough progesterone, so cycles will be all over the place. Breast tenderness can occur, depression and anxiety. So I can't tell you how often I see women diagnosed with anxiety or depression that are put on medications when what they really need is just hormone balancing. Mood swings, so PMS, PMDD, that that progesterone drop before your cycle starts is what triggers that PMS for some people. That is extremely significant. Like they are off the rails. They want to take somebody out that week. Usually a progesterone deficiency there. Trouble sleeping is another one, and weight gain, because if you don't have enough progesterone to balance out your estrogen, you become estrogen dominant, which I'll talk about a little bit more in my estrogen series. But we need a balance there. We need to balance things out.
So, a lot of that is lifestyle stuff. Also, I know there's age stuff as well.
Yeah.
So are there natural ways to boost your progesterone? And then I know there's ways that you can replace it.
Yeah, absolutely. So like I said, the adrenals are involved in helping to produce progesterone. So stress reduction can help with normalizing progesterone levels when we're younger, when the body still is wanting to make progesterone. Once we hit peri and postmenopause and the ovaries are failing, we're just not getting the same production there because the ovaries aren't doing what they need to be doing. So when we're talking perimenopausal and postmenopausal, there's some more specific things that we happen to see. Low libido, fatigue, vaginal dryness, and trouble sleeping, mood swings, anxiety, depression are the more common ones. Peri and postmenopausal. Childbearing years, again, it's more issues with periods, PMS, things like that. So how I'm going to address it depends on where we are in life. If I've got a healthy 30-year-old woman that's just having severe PMS and can't stand to be around anybody for a week, I'm probably going to lean more towards stress reduction and trying some supplements before we go into bioidentical hormones.
Got it.
Whereas postmenopausally, probably more likely to go into the bioidentical. So natural ways, like I said, stress reduction, dietary changes. The healthier we eat, the healthier we are, the more our body wants to function and do what it's supposed to be doing. We can supplement with things like vitamin B6, vitamin C, zinc, magnesium. Those all help support progesterone production. Some people will use natural progesterone creams that are over the counter. Usually those are made out of wild yam. Hard to say really the consistency in those. Every brand is going to be a little bit different. Some women see good relief with them. Some women see absolutely nothing. But if we're wanting to stay completely natural, that is an option. Inositol is another supplement that I use. This is more for my childbearing age women, especially with PCOS. Studies have shown a dramatic increase in progesterone levels using myo and dechiro-inositol.
Interesting.
Yeah, so
Okay.
it's a great one. Any patient that I have that's having trouble getting pregnant, and that's the end goal is conception, I talk about inositol because it's a really, really awesome one. And then again, we also have bioidentical hormone replacement therapy. This can be done through a compounded cream applied to the skin, something called a troche or a trit that dissolves underneath the tongue, and then it also comes in a pill form. Now, progesterone is the one and only hormone that I will replace in a pill form. All the other hormones, I don't like the way that it hits the liver, the first pass effect, the way it breaks down in the body. So I do not do estrogen or testosterone in a pill form that you swallow.
Okay.
Progesterone, we do. And that tends to be more the way that I prefer to go because whenever we take progesterone orally in a pill form, we get the sleepy effect from it and we get the calming effect from it. So this is one that I recommend women take at night before bed. And it really helps to get into that deeper sleep, fall asleep, stay asleep. And again, we feel more relaxed. We're not as anxious. Mood is better. Things like that are coming from that progesterone replacement.
And I'm assuming that the amount of progesterone that you put on is determined by how low the progesterone is?
Partially, and then partially again where we are in life.
Okay.
Usually perimenopausal or postmenopausal where those ovaries just aren't doing anything for us anymore. I usually start at least around 100 milligrams a day. That's where that uterine protection is going to come from. And that's where we're going to get those sleep benefits and everything else. If I've got a younger cycling female, I'm completely changing it up. We're using lower doses, maybe 25 or 50 milligrams. We're only using it on certain days of the cycle to mimic the body's natural times for progesterone to go higher.
Got it.
So it's a completely different method. Now, one thing to mention, I do see women come into me who have had hysterectomies and they've been put on estrogen replacement by another provider and have been told, you don't have a uterus, you don't need progesterone. We'll talk about it a little bit more in with the estrogen, but if we have a uterus and we take estrogen without progesterone, we build up that endometrial lining too much, risks for cancers and things like that, bad things that we don't want. So when they take that uterus out, oftentimes they'll tell women, no uterus, no progesterone, it's not needed. That's not always the case. Progesterone still helps to balance things mood-wise. Progesterone still helps with sleep. So just because you don't have a uterus doesn't necessarily mean you don't still want to be on progesterone to balance things. So that is one thing that I see very often, and women will end up being estrogen dominant and feel terrible on hormones when all they really need is just add some progesterone on, balance it out, and feel a lot better.
I know we need to wrap up soon, but this is a very dumb question, I think. How do you measure progesterone? Is it just one level or?
Yep. So it's just a blood draw that we do. And when we do it depends again on the woman. So normal cycling, like if a female has normal 28-day cycles and we're worried about progesterone levels, we want to draw those labs on day 19 to 21 of the cycle.
Okay.
So we're getting that post-ovulation spike in progesterone is what I'm looking for. If we have someone who's peri or postmenopausal, not really having periods anymore, we draw it whenever. It's not as critical. When you're cycling, day 19 to 21 is the critical time to get the most accurate reading.
Now, once they've started, if you guys decided to go on some sort of replacement, where do you like your levels? Is it a ratio or?
It's about the ratio for estrogen to progesterone as part of it. As an individual number, it also depends on if we're young and cycling or if we're older and postmenopausal. Those numbers change as well. But yeah, ratio is part of it, and then where we are age-wise and what our goal is with our replacement.
Super fascinating. Progesterone.
Progesterone.
Guys, pay attention to progesterone. I hope you guys got a lot of value out of this. Robin, thank you so much for explaining it. Guys, you guys name it, we explain it. As always, we'll see you guys next time.
Don't go away.